Hello everyone, I'm Gabi and you are watching a new Dentapreneur material. I want to present in this video how we can manage competition in dentistry, a free course that will be divided in two parts. For those of you who are watching a Dentapreneur video for the first time, I want to mention the meaning of the word. Kind of intuitive, it comes from dental and entrepreneur, and it represents the dentist who takes into consideration both of the main aspects of a dental practice, correct and high-level treatments, and also improvement and growth of the dental office or clinic as a business. Also, I want to mention from the beginning that during the video we will see QR codes that are associated with different links where you can find useful information and more details about the specific subjects. The links are also in the description of the video. So now let's start with the course. First of all, it's important to be aware of the fact that there are two types of competition in dentistry: the indirect competition, the true one, and the direct competition, the other dental offices and clinics. In this video we are going to present how to manage the indirect competitors, and in the next video we'll approach the direct competitors. What do you think I'm referring to with this indirect competition? I'm talking about the new big clinic in town that has huge discounts, or about the high-tech aesthetic practice that just opened into the shopping mall? The answer is of course not. Well, we are talking about competitors on the budget of the patients that are not related to dentistry. Some examples are Apple, Mercedes-Benz, Gucci, or Louis-Vuitton. People are spending their money on other things or services because they don't prioritize oral health. And I think you know what I'm talking about. There are a lot of memes on the internet about this, like this, like this. And this happens also because all these companies are doing a great job of convincing your patients, of your potential patients, that their money is well spent on their products or services. The next obvious question is, what should we do? As I was saying, people don't prioritize their need for dental treatments because they don't value it enough. Let's face it, most people associate dentistry with inconvenience, pain, and high costs. That is not how they think of a smartwatch or iPhone. It didn't happen to you to see a patient who refused that treatment because of the costs, but he or she had the latest iPhone model? Why do they value smartphones, smartwatches, and clothes? Let's learn from our competitors. Apple, Samsung, Mercedes, or clothes companies are investing millions of euros or dollars in advertising, while practically no one is educating the people or trying to convince them to take care of their oral health. People are exposed to around 4,000 up to 10,000 ads each day, and probably a maximum of 5 are about dentistry. Getting back to the motto of this part, we have to make patients prioritize oral health. So the first thing to do is marketing as much as we can, everywhere we can. Facebook and Instagram posts, Facebook and Instagram ads, newsletters, ads on different websites, YouTube ads, Google ads, and so on. Do you know how many times the patients have to see an ad before taking into consideration your services? Well, modern research shows that on average they have to view an ad at least 7 times before taking action. So that is why we have to insist on different channels if we want our marketing to work. How much should we spend on marketing? The answer to this question depends on some important technical factors: new patient revenue, patient acquisition cost, or patient lifetime value, but we're going to discuss it in a future video. For now, just keep this in mind. The more revenue you want to generate, the more you need to spend. There are a lot of studies and statistics about how much we should spend on marketing as dental businesses, but the average is between 4% and 7% of the annual revenue. And this also works in the other way. So, if you want to have a revenue for the next year of a certain amount of money, you should invest in marketing between 4 and 7% of that revenue. To be more concrete, If your annual revenue or your desired revenue is €1 million, you should spend between €40,000 and €70,000 on marketing. I want to point out that marketing is a complex subject, and we're talking now specifically about digital marketing. Besides the importance of marketing, and specifically digital marketing, you can communicate to your patients the value and importance of dental treatment in other ways too. When patients first come in the dental office, show them the interesting and human face of dentistry. Take them into a tour of the dental office, explain them the importance of oral health and the consequences of not taking care of it, introduce them your team, and if they don't need an urgent treatment, don't treat them at all. Why do that? We all know that the first impression is the most important one. Dental impression is the exception. They expect pain, discomfort, and high expenses, and you will change their world and opinion of dentistry, and of course their perception about what is dentistry. It is also recommended to not charge the first visit. Besides the fact that you cancel a negative expectation in not charging them, you also use one of the main persuasion principles, reciprocity. This method says that people tend to pay back what they received from others, so patients will want to compensate for the situation, and there are way more chances to come to the next visit than the paid consultation scenario. Getting back to how we can make patients realize the importance of oral health, another solution would be adding in the waiting room some meaningful messages about it. For example, a beautiful smile doesn't mean only white teeth and fresh breath. It's also about being confident and feeling comfortable and appreciated by others. Don't make discounts and don't have low prices. Of course, you may ask why. There are many points to discuss here. A recent study has shown that most people associated high prices with high value and low prices with low value. So having low prices is kind of the way to communicate that your value is under the average. Let's face it, when they really think about it, most people don't really want discount treatments done on any part of their body. The most challenging and difficult patient is the one who came to you because you are the cheapest dentist, and we really don't want this kind of patient. People ask about costs because society teaches them that dentistry is really expensive and they are afraid of not being overcharged. So when people call and ask for the cost of the treatment, a good answer would be, every patient is different, but it sounds like something that the doctor would be very concerned about and would like to get you in the office right away. Don't worry about the cost of it right now. Our fees are reasonable, but I really think you like the care that the practice offers. In this way, you communicate that you care about him or her and make them realize they should prioritize their health and not the cost. You have to understand that the patients are not motivated on their own to pursue good oral health. We are not used to this in most societies, but most people have the money or they can find it. There are not too many dentists, there are too many non-patients. If you want to push harder in the marketing area but you don't know where to start, I invite you to schedule a free coaching session right here. We will discover together how you should improve your marketing. People, here is the end of the first part of managing competition in dentistry lesson. Hope you enjoyed, and if you want to stay updated with our activity, online courses, trainings, events or articles, you can follow us on our social media channels and subscribe to the newsletter. Because I want that this information to be useful and practical, I'm challenging you to do the next 3 tasks until the next part. Start using at least one of these marketing methods that you are not currently using, of course. Facebook posts, Instagram posts, Facebook and Instagram ads, LinkedIn posts, Google ads, YouTube ads, newsletter. Next time you have a new patient, implement what I said a bit earlier. Give him or her a tour of the dental office, introduce them to the team, and don't treat unless it's something urgent. It's necessary to do this only with one patient, and then compare the later behavior with the behavior of the other patients. See if there's any improvement there. The last task is to add a motivational message, painting, drawing, poster, everything regarding the importance of oral health in the waiting room. The next part will air in a few days, so stay tuned. We will learn about how to manage our direct competitors, other dental offices and clinics. Wish you a wonderful day. You are a Dentapreneur, you're more than a dentist.